what's frightening is something like this, which is sufficiently transmissible before symptoms exist to infect a large number of people, and then mild enough that people don't realize that there's a problem until relatively large numbers of people are dying.
And hello for possibly the last time this year, not quite sure yet. My name is Christopher Snowdon. You are watching the Swift Half with Snowdon. It's a half-hour chat show with somebody I think you will find interesting, and I'm quite confident you will find the guest in this episode interesting. He is Bill Hanage. He is none other than a professor of epidemiology at Harvard University, ladies and gentlemen. And our paths first crossed almost exactly a year ago, just as the Omicron wave was getting going. Bill, how are you doing?
I'm all right. How are you?
I'm okay, really. I'm wrapped up nice and warm. I've got 2 jumpers on, trying to deal with the increasingly cold weather. What's it like, the weather where you are?
Wet.
Wet.
Wet. It's almost Scottish.
We've had astonishingly wet weather throughout November. I think the wettest November ever, I would imagine. Just never.
What was crazy was it was like 25 degrees a couple of weeks ago, and then over a week it went to -5. It was just really wild. By the way, this is the Swift Half. In your honor, I'm drinking an IPA. Although I will point out, given it's 10 o'clock in the morning here, it's a non-alcoholic IPA.
Very sensible. Yeah, kind of look at it. It looks like a craft beer to me.
Yeah, it's Athletic Brewing Company, Upside Dawn Golden. They sell them locally in Whole Foods, although bizarrely they wanted to ID me.
Yeah, they do.
Alcoholic beer.
You obviously look under the age of 40.
Yeah.
That's all that's required. So let's go back to not the beginning of COVID, but the beginning of our sort of relationship together. You FaceTimed me actually, didn't you? About a year ago, as we're getting towards Christmas,
Yep.
to basically ask me how I thought it was going to go. And that's really for the last year. Every now and again, you ask me how I think it's going to go. I say it'd be fine. You say you think it's going to be terrible. And
fortunately, that's not. No.
Go on then. What's your version?
No. That's a misrepresentation. I think the reason I got in touch with you the first time is because you are a member of the reality-based community, and I don't always agree with you. But if I only talked with people I agreed with, life would be very boring, and I would just exist on social media, and I don't. So I think it's important to check in on these things. I mean, my concern at the time was that Omicron was so obviously very transmissible that lots of things were going to be happening. Lots of people are going to be infected extremely quickly, and people just were not prepared for that eventuality. And, it was going to be like, I was actually talking to a journalist at one of the national newspapers here in the States, and I was just telling them, holiday travel is going to be so insanely disrupted because all of your flight crews are going to get sick at the same time. If everybody in the world gets the common cold at the same time, it's a big deal. And people didn't seem to really realize that. And anyway, that's what happened. BA1 came along, huge numbers of people were infected, 30, 40%. Fortunately, due to vaccines and accumulated immunity, the consequences were nowhere near as dire as they might have been, although they were probably still worse than they would have been had we been facing Delta. And then since then, we've seen this procession of things which are wandering through immunological space. And some people get terribly upset about them. But it's, getting upset is not a scientific answer. Getting upset is only slightly related to scientific reality. But yeah, still BA1, the first Omicron wave, one of the most amazing things I've seen. And it was really astonishing. And I shared some of that astonishment with you.
Yeah, and my feeling was it was going to be okay, and the hospitals were, pushed. The original SAGE prediction was there'd be over 1,000. I'm obviously talking about UK here, over 1,000 hospital admissions a day, which there were eventually, but the death rate remained really quite low, and probably a lot of those people in hospital weren't.
And some of those would have been hospitalization with rather than for.
Yes, quite a few, an increasing number, right?
Yeah, and increasing proportion of them. But it is also worth noting the local folk, people really hate that framing. Not because it's wrong. I mean, it's reasonable. Epidemiologists do need to take that difference. But if you've got somebody in your hospital with COVID at that stage, it's a massive headache. It hugely disrupts stuff. It's all, so the issue there, and actually the issue now in the UK, is context. It's not that you've got a huge amount of COVID like you had in the past. It's you've got it against a background of other infections, other things which are broken down. You know, that's going to have other consequences. You're going to have to postpone all your colonoscopies because of the fact that all the people who are doing the colonoscopy are sick, or the person who was having it is sick. There's going to be all of these things. So it's like keeping an eye on those knock-on effects. All about context.
But that kind of never really happened either with Omicron. So you've just reminded me, actually, although all the predictions were, you know, come January, you're going to have 30% of teachers are going to be off work with Omicron and 25%, and they were. I mean, quite a few of them were, but nowhere near that proportion.
Not as much as that. I mean, it depends on which time period you're looking at. Probably around 30 to 40% of the US was infected with Omicron over January. I mean, it was pretty remarkable. And it was significant disruption. You know, the schools where I live in Cambridge have been pretty open for most of the time. And they actually they were open through that period as well. They were actually one of the best real world experiments in transmission dynamics. But there was a point in time when it was pretty dicey. But still, it was a lot worse than some people, a lot better than many people might have feared.
Yeah, I mean, my daughter's school, she was at primary school then, she was secondary now, but she was at primary school then. And, you know, there was a bit of disruption because like half the class would get COVID and they wouldn't be at school for a week. And then the teachers would get it, but they only got it the once really, you know, and then they come back and it was.
And then they come back. Yeah. And then you also have to figure out those. And then this is one of those other things which, you know, folks who don't think about this all the time often don't realize, which provides people with headaches, which is how do you change your isolation guidelines? Because isolation guidelines at the time initially going in were like you had to be 10 days, which was going to be much more disruptive than 5 days. And that was going to be changed, but without the sort of evidence base that people would like to have, because it was just, you were having to make those decisions on the fly in order to keep the show on the road. As it was, a lot of places locally, well, they did not rationally use rapid tests, put it that way. A rational use of rapid tests would have been to allow people to keep going to school who'd been exposed and were not infectious, or to let people back into school. But instead they were sort of saying, everybody do a rapid test on Friday, which is not particularly useful, I've got to say.
Yeah, they're doing twice a week, at least, I think, in the NHS.
Yeah, I mean,
and I think they did drop it to 5 days quite quickly. I can't remember when they did it, but it seemed they did it at a reasonable-ish time, I think. So what's been happening with the variants since? Because I haven't really paid attention. I just know that they're all basically just versions of Omicron. And
well, they're all descendants of Omicron. If you're as much of a nerd as I am, you would, and you're not as much of a nerd as I am.
No.
You know, you're not a nerd at all. You'd know, you'd be amazed and kind of by the fact that that first wave of Omicron, which infected so many people, has not left any descendants. Not really, not in any numbers. It's now pretty much extinct, at least here. And then what immediately happened after BA1 was BA2. But BA2's peak was very small in comparison to BA1. Why? Well, because lots of people were vaccinated and immune. And then BA5 started to come along after BA2, but you know, people asked me what I thought would happen. Would there be a surge and would it be a big deal? And I said, you know what? BA2 has only just started to abate. There's a lot of people with immunity around. There will be more infections than there would have been, but still probably not huge numbers, not a big deal. And that's kind of the situation that we've been in since then. We've now got a load of variants which are advertised as being immune escape variants. And you know what they are? They are better able to infect you than what was around a couple months ago. But that doesn't mean that you will be infected, because a substantial proportion of people have immunity through vaccines or infection or both. And that puts a lid on the number of infections that can happen at any one time. So absent another Omicron, which we can't rule out. Absent that, we're just expecting there to be a continual process of infection, which will not approach the numbers that we have seen previously. Although it's still going to go up a bit because, people gather and do things socially over the holidays.
So it's just a seasonal virus, really. So
driven by human networks. Here, Thanksgiving, it's like, they opened the schools, bunch of infections. Why? It's rampaging through the schools, infecting everybody who can be infected. And then once it's done that, kind of runs out of things to do and then just drops down to low levels. Thanksgiving happens. Americans go and see family and they eat a lot of turkey and so on. Virus gets introduced to new networks, runs through them, starts to die down again. Holidays happen. People go to parties, infect a bunch of each other, goes, etc. If previous patterns are maintained, there should be a peak somewhere in early January, which is what we saw with Omicron. It's what we saw the year before, and it's what we see with the seasonal coronaviruses. Humans, it's all about us.
Yeah.
All the patterns and networks we make.
Right. And people don't really do anything at the start of January because they're skint and the pubs are empty and it's cold and they just want to, they've done all their socializing. So these things naturally kind of fizzle out a bit.
Yeah. And there will be far fewer opportunities.
And how many times do you think we can expect to get a variant of COVID? Roughly once a year, or?
It depends what you mean by a variant. I mean, it's continuously doing its infection and mutating. It's a question of whether or not they are significant. And the way that I try and relate this is by comparing to flu. Because to a first approximation, you are right when you say that these things are not a big deal. If by a big deal you mean in comparison with previous waves, absolutely. But thinking about the US in particular, the amount of deaths that we are seeing at the moment, if you added them up over a year, are still going to be 3 times or more than what we would have counted as a bad flu season. Okay, that's quite big. On the other hand, do you know when the last bad flu season was?
2017 in the UK, I think.
Well, okay, right. You may not be a random sample of the population.
But no, you're right. Most people don't.
A lot of people don't. And even when it does happen, it's something that registers as being far off. And they might, not many people pay attention. They'll see a few weeks of their hospitals being stressed. There'll be a couple of things on the news at 10. You still have the news at 10, don't you?
Yeah.
Newsnight special, that kind of thing. And then things will move on. And for a lot of people, it's in that territory. And I think it's understandable that it's in that territory because I know about this because it's my job. And also part of my job and part of the things which are very difficult for epidemiologists is, in general, is balancing sort of harms, costs, etc., things like that. That's not easy. And right now, I wouldn't want to criticize people for going out and living their lives. I might want to criticize somebody if they went and sort of hung around a bunch of people who were coughing and then went and sung karaoke in a nursing home full of unvaccinated older people. That I would have a problem with. But other things, I don't think it's as, I think that we have to keep these things within that context.
Do you think epidemiologists had a good pandemic from a reputational and professional point of view? I think the field has shone in the last 3 years.
There are some things there are some good things. There are others which should be learned from. Somebody actually asked this question of me at a panel a couple months ago. And somebody else who was smarter than me answered, it wasn't that there were too many modelers, there were too many people modeling. And that was an interesting take. I mean, I actually did this math recently. And, Imperial College gets a lot of criticism. And I should point out, I used to be at Imperial. I know a lot of the folks there and have done for decades. But if you ask the question of, if you recognize their original stuff not as a forecast, but as a general, whoa, this is bad. Something really bad is going to happen. You need to do something to stop this bad thing happening like now. It's
Well, that's
actually,
a forecast straight away. If you're saying it's going to happen, that is a forecast.
yeah, that's true. But it's not, epidemiological models are not forecasts. They are ways of finding out about futures that you never want to learn about the hard way. That's what they are. So it's an impetus for action. Now, what then got messed up, and I've really been very, very annoyed by this, is around June, July 2020, I think that there should have been a really serious sit down and conversation about long-term pandemic management, because it's a marathon, not a sprint, which never happened. Ever, because by that point I mean, I know you know this, we were divided into a group of people who were just saying that the virus didn't really exist, and it's all made up, it's not there, and another group of people who were at that stage probably the more reality-based of the two, who were claiming that it was the end of Western civilization at the extremes. And over time, once you get divided into that camp, those sort of things, all the serious discussion of what you need to do becomes much more difficult. And that's very, very, very hard. And I've been pushing against it for ages, but I've been called all kinds of things. I've been called a lockdown maniac. I've been called a COVID minimizer. I have received threats from all quarters, which, I guess is the cost of doing business.
Yeah, well, yeah, me too. But I mean, that's just Twitter, isn't it? Really, the debate wasn't really between those two extremes, or it certainly
No. It should not have been. But once you get something framed as that, then it leads to this kind of paralysis. The real serious debate would be. I mean, let me think. This is an example. It's just off the top of my head. And all the epidemiologists that I take seriously over the summer of 2020 were thinking, what's going to happen in the fall and winter? Because it is going to get bad again. And we know it's going to get bad. And nobody seems to be taking that seriously. Why? And I think it's partially because the news cycle was being driven by, frankly, silly conversations about people doing things like going to the beach and whether or not it was safe and things like that, which are just not particularly helpful. And then also people would look at the going to the beach and then say, oh, we're not getting a whole load more infections, it must be all right. That's not an unreasonable inference to draw, but we also know, we who work in infectious disease know that the winter is going to be worse than the summer, and so you need to prepare for it. Speaking locally, it's kind of, we did a lot, initially there were a lot of school closures which were intensely damaging. And in order to get them open again, there was a lot of stuff done in terms of improving ventilation. There was, I mean, they went around every place that was going to be occupied, and they checked the ventilation. They improved it. They gave masks to every teacher. They prioritized teachers for vaccination, and then still some of the teachers wouldn't come back. But the upshot was that kids were mostly in school from sort of September 2020 onwards, with a few interruptions, but not many. And there were very, very few transmission events in the schools, very few. And that was, that was down to effort. There was one point when they had so much hand sanitizer that the fire department had to call up and say, you've put all of this stuff in one place. It's a massive risk. If you get a fire near here, there's going to be a huge explosion. And so they put a lot of effort into that. And it had, it had benefits, but probably the more useful benefit ended up being this thing where the rapid tests started to be being used to prevent people being absent, kids having to go home because they've been exposed or people thought they might be infectious, because that's a really good thing. It prioritizes education, and it starts also being more realistic about prospects for long-term pandemic control.
And going back to that summer of last year, so round about the time of Freedom Day, so it gets pushed back 1 month to allow even more people to get vaccinated. And then you get to 19th of July, all the restrictions are going to go. And as usual, the models come out saying this is going to be a disaster, and implicitly we should maintain some restrictions at least. And that was an instance where, I guess the baseline scenario of the government not doing anything was what happened. And what actually happened was it peaked straight after the football, which
which is it's funny. It's funny you say that, because this is one of the things that I got wrong. I got the peak right. I got the peak right, and actually, there's somewhere on the internet, I actually gave evidence to the All Party Parliamentary Group, and they said, "What's going to happen after Freedom Day?" And I said, "Well, actually, you're going to have a peak, and it's going to start coming down," and that's because the schools will have gone out, and basically the transmission in the schools will just cut that. All those opportunities will just be denied. But you are right that the football, you can see it, and from when Scotland and England went out of the Euros, there is a very strong correlation. So basically, the football plus the schools was there, and so the magnitude of the drop was larger than I was expecting. Although after that, we continued. That continued Delta transmission throughout the later part of the year was not particularly surprising. In fact, I hate to use this word because people misunderstand it all the time. But at that stage, it was probably the closest anywhere in the world had got to being endemic.
Right. Yeah. Yeah. Well, that was true. That's why I was quite sanguine about it after that point. Then, of course, you got Omicron right up before Christmas. And I agree, it did look a bit dicey. But then there was some more modelling, of course, about, like a week before Christmas, London School of, I think it was London School of Hygiene and Tropical Medicine. This is going to be, how many, I can't forget now, 3,000 deaths a day or something like that, And
when you think, sorry to interrupt, because I think this is a really, this is an opportunity to, get an insight into the way that people actually think about these things, or, the way it's done. You have to make assumptions. You have to, and that's what would happen if a certain set of conditions prevailed. Now, you don't know that those set of conditions will prevail. You don't know for a fact exactly what's going to happen, but you make a bunch of assumptions, and then you check to see whether or not, how many of the reasonable amounts of possible assumptions lead to something which is quite bad. And if it's quite a lot of them, if it's really hard, then that's a very different result from if it's very easy. Now, as it turns out, there was a lot of question about how severe Omicron was. And the answer to that is very severe if you're in Hong Kong, where people have not been vaccinated in older age groups and there's very little convalescent immunity. But in somewhere like South Africa or the United Kingdom or parts of the United States, not so much. Its major damage comes about from it being very, very transmissible and infecting lots of people very quickly. And so tiny proportions will get seriously ill. But because there are so many people infected, that becomes a bigger deal. And it's like, but then also you get people saying, Omicron's mild. Oh, it's not mild. It's like, it's milder than Delta. I would have rather been infected with Omicron than Delta, to be entirely honest. Even though actually, so far as I can tell, and so far as my antibodies show, I've never actually been infected at all, which is
really?
quite remarkable. Yeah. I've not been making huge efforts to avoid it. But my kids have both had it. But still, maybe I'm one of those people with some kind of, maybe I need to enroll myself in a study.
You're not a heavy smoker, are you? I would do it.
Nah, I'm not a heavy smoker.
Just finding out this modelling thing. You're right. It depends on the assumptions that go into it. And the main assumption in these particular models was that the government wouldn't do anything, right? And there was a huge confidence interval in these models. So there would be something like, this is the absolute best it's going to be. This is the minimum number of people are going to die this winter is like 2,500, and it turned out to be 400 or something like that, right? The missing bit is human behavior, right? That's the thing that they then say, oh well, we didn't realize people were going to behave like that.
That's a really good point. I actually think that a colleague of mine who's based in the UK and is now, he's an old friend, made a comment very early on that the human behavior piece is extraordinarily difficult to handle, but also incredibly important. And it's something we really do need to learn from. I mean, really, it's like human behavior in this is the big unknown. Like, you can make assumptions about human behavior. And humans being humans tend to, like, fart in the face of your assumptions. This, it's one of the things that we do. And so I think that's important to learn from that as well going forward.
Yeah, and I think some of the models have said there's a sort of endogeneity problem in it, in that, they put a model out saying this is going to be terrible. People immediately respond to the model. I'm not sure how true that is, but I mean, I suppose it's part of the hysteria that might make people, lock themselves down to some extent. Can I ask you about China? Because we're already running out of time.
Yeah.
Short show this. So, well, I mean, I kind of expected once Z got re-elected that he would quietly phase out the zero COVID thing, but it doesn't seem like he's going to do that at all.
Yeah,
So,
I was surprised. I'm not an expert on China, and I try to avoid speculation, at least, or restrict speculation to things that I'm an expert in. But I think that I was surprised. I really am quite surprised by that. I mean, the risks to China are quite severe. So one thing that a person in my group did about a little over a year ago, we published a paper which said, right now in this kind of phase, in order to really take off and be serious, something needs to have immune escape and be more transmissible. And then literally a week later, Omicron said, "Hello, I've read your paper. Here I am. I'm about to sweep the world." But one of the other things that we were able to do based on that was to say, what would happen if something like that occurred in a place with limited immunity, limited prior infection, and convalescent immunity, somewhere like China or Hong Kong. And the results are pretty grim. And we could see that about a year ago, and Mary gave a talk to some people here about it. And then, of course, we saw what happened in Hong Kong. Hong Kong has had a really, really rough time of it. Mainland China has not so far, but right now it's pretty obvious that transmission is getting established, and there are just so many introductions that it's going to be there. If you could do one thing for global health that would really save lives, it would be to magic mRNA vaccines into the arms of every older person in China. And that would save huge numbers of lives. As it is, were you to see the same per capita mortality in China as we did in Hong Kong, that would be, I think, somewhere around 4 million deaths or something like that. Maybe somewhat less, but a lot. Oh, sorry, no. Never do math in public. Sorry, it would be about 2 million deaths. 2 million deaths. In other words, twice the absolute numbers as the United States, but in a country with 4 times the population. So it would still be better than it could have been, but it's still quite huge numbers, and it's come at enormous economic cost to the country.
Yeah, and they can't really get out of it, right? Unless they're going to actually start forcing old people to take vaccines or get a better vaccine. But both of those things seem to be the two things the Chinese government won't do.
Yeah, I mean, it's I don't understand their mentality.
Well, they've prided themselves on zero COVID. That's the thing. They have prided themselves. They have been laughing at the West. I don't just mean the party. I mean, the population have been scoffing at the West for 2 years, saying we've done it better. Everybody else has failed. And they can't back down on that. And particularly the leadership can't back down on that. I think that's what's going on.
Yeah, it's quite, this is an observation I'm going to make. Again, it's not something that I'm an expert in. But my observation of authoritarian regimes is that they don't believe something until they decide they do believe it.
Right.
And so
you think they'll change their mind on this, right? And just
I think that at some point they would be. At some point, I would expect them to. Although let's face it, they're not exactly gifted in terms of messaging. and persuasion. So I think it'll have to happen at some point because the alternatives are just not tenable. And also I don't want to label people, I don't want to label people who are concerned about the virus as necessarily zero COVID, but we do also have to point out that if you're talking about zero any infectious disease, you probably haven't studied very many infectious diseases because we haven't managed to get rid of a lot of them. Now, we can do a lot to make them better. That's what I spend most of my time doing. But actually eliminating or eradicating them is a huge ask and not something which we were ever really going to be able to manage with this particular baby. Certainly not once you have Alpha, Delta, and Omicron coming down the pike at you.
Okay, last question, because I think we're already running over time. But before all this started, was COVID-19 the kind of thing you were expecting to see at some point in your career?
Yes. Although, the potential pandemic pathogens that most people would have been focused on would have been flu. And in fact, we could have a whole other conversation about why using flu as a sort of mental model for this is wrong. But a respiratory pathogen that was capable of doing this, yes. And the reason I say that is because we have. 2009, we saw H1N1, which was a pandemic. It was just, it just was not really particularly severe. But one of the things which has been truly tough about this one is that it's got this kind of sweet spot. Ebola is not going to cause a pandemic. I find it virtually impossible to imagine a situation in which Ebola causes a pandemic because it's such a big deal. It's so obvious, and people have to be obviously infected before they transmit.
Yeah.
Instead, what's frightening is something like this, which is sufficiently transmissible before symptoms exist to infect a large number of people, and then mild enough that people don't realize that there's a problem until relatively large numbers of people are dying. So you can sort of look the other way until you can't look the other way anymore. And that combination is something which is very, very hard to deal with, very hard to message. But yeah, I think we were expecting to see something like this, although probably not necessarily a coronavirus, even though we thought that there was a potential for that after the original SARS.
Okay, right, we've got to go, I'm afraid, Bill. It's been great speaking to you.
Sorry, it's been could have talked much longer, but I've got meetings to go to, and you've got an evening with probably some beer in it.
Quite possibly. Thank you very much, folks, for watching at home. We might be back in a couple of weeks. It's nearly Christmas, and we'll see how it goes. I'm going to find somebody to interview. I will give you one more episode. Otherwise, we'll see you in the new year. If you're a donor, thanks very much. If you'd like to donate, go to iea.org.uk/donate. And I will see you, or you will see me, at least in a few weeks. Let's keep it as vague as that. Thank you very much, and goodbye.
Happy Christmas.
Well, if you enjoyed that conversation, why not watch one of these other videos? And while you're here, remember to hit the subscribe button and the notification bell. That way, you'll never miss out on a single IEA broadcast.